Why is blood pressure management crucial in acute stroke? Imagine your brain as a busy city with roads that need to stay open for traffic. When a stroke happens, those roads get blocked or burst, disrupting the flow of blood and oxygen. Managing blood pressure during this critical time is like controlling traffic to prevent further chaos. If blood pressure is too high, especially in ischemic stroke caused by a clot, it can push blood into damaged areas or cause bleeding, making the injury worse. On the other hand, if blood pressure drops too low, the brain may not get enough blood, leading to more damage. In ischemic stroke, high blood pressure is common at first because the body tries to compensate for reduced blood flow. But if it gets too high, above about 180/105 millimeters of mercury, it raises the risk of bleeding into the brain, called hemorrhagic transformation. This can happen after treatments like clot-busting drugs or mechanical removal of the clot. To keep patients safe, doctors aim to gently lower blood pressure to below these levels before giving these treatments, usually around 185/110. During and after treatment, maintaining blood pressure within a safe range helps prevent complications. In hemorrhagic stroke, where bleeding occurs inside the brain, high blood pressure can cause the bleeding to get worse. The goal here is to lower blood pressure quickly but carefully, often to around 140 millimeters of mercury systolic, to stop the bleeding from expanding. But it's equally important not to lower blood pressure too much, as the brain still needs enough blood flow to survive. This delicate balance helps limit brain damage and improves chances of recovery. Managing blood pressure in stroke is like walking a tightrope. Too high and you risk more bleeding or swelling. Too low and the brain doesn't get enough blood. The exact targets depend on the type of stroke, how far along it is, and what treatments are being used. For example, in hemorrhagic strokes, more aggressive lowering is often needed, while in large ischemic strokes, doctors may be more cautious. Overall, controlling blood pressure during an acute stroke helps prevent further injury, reduces the chance of bleeding complications, and supports effective treatment options like clot removal or clot busting. It's a vital part of stroke care that can influence how well someone recovers and their chances of survival. Remember, each patient is different, so treatment plans should always be personalized and guided by healthcare professionals. Ongoing research continues to improve our understanding of the best blood pressure targets in these urgent situations, but the goal remains clear. Keep the brain safe and give it the best chance to heal.